more time. Like a school teacher, right? Flashing the lights and good morning. Maybe everyone's not awake yet this morning. Well, welcome to this month's presentation. I've missed you guys for a few months. I can't remember. Last month, Wellness Week was going on, so I did not present. And then in April, I had parents who both had surgery 6 days apart from each other. And so I felt like I needed to not be here, but to take some time off to be with them. So thank you all for understanding. But we're gearing up. It's summertime out there. If you haven't been outside this morning, it's very humid, very, very damp. So we're going to talk about aging with radiance. And all of you look very radiant this morning. Nice and smiling and bright and got beautiful colors on. So we're going to talk about caring for your skin. And you all may remember parts of this presentation from last year. I did this presentation last summer. And we're going to recap on these areas again today. I had you all samples of sunscreen and samples of lotion. And, of course, they're not arriving until later today. So no table with giveaways today, but if you want to stop by the clinic tomorrow, feel free to ask, and I'll have the samples to provide you. So we're going to talk about why caring for your skin matters. And I always like to talk about first how the skin is the largest organ of our body. How many of you already knew that? Look at you smarties. Everyone's so smart around here. So your skin is the largest organ, and it's your first line of defense. It protects against environmental exposures, damage. It helps us to regulate our body temperature. I know coming into this room this morning, I welcome this cool air because, you know, I'm still having flashes at times. But I know Mr. Cole said, you know, I'm used to wearing my jacket. I said, well, you were smart to bring it because it's chilly in this room. But our skin helps regulate our body temperature, and our skin helps produce our vitamin D. And as we age, we need extra skin care than maybe what we needed when we were younger. Healthy skin not only protects us, but it helps us to feel better emotionally, right? I know when I have washed my face and maybe put on a little bit of makeup, most of you know most days I do not paint the barn, as my dad calls it. He tells my mom that she's painting the barn when she puts on makeup. And but most days I do not wear very much makeup at all, and I don't think you all care whether I have it on or not. But as our skin looks good and feels good, then that's going to make us feel better about ourselves overall. So naturally, our skin does thin and it loses moisture easily as we age. And so how many of you can agree that if you pinch up the skin on the back of your hand, it feels like tissue paper? And how many of you have had a skin tear where all you did was rub up against a piece of furniture or roll over in bed and now you're bleeding because your skin tore? Well, that's because it is thinning as we age. We lose that collagen and that cushioning that's underneath our skin, and so it leaves our skin very delicate. So you will notice increased dryness and thinning, cracking, bruising, and skin tears. I always think it's interesting in the clinic when someone says, "What is this on my arm?" And I look at them and I say, "Well, do you want the technical term or do you want the layman's term?" The layman's term is you have a bruise. The technical term, which I don't care for, and I didn't make this up, senile purpura. Senile. Why senile? Because most of us don't remember what we did to get that bruise. So that's why the medical professionals way back when labeled that purplish bruising under the skin senile purpura. It's purple but we usually don't recall what we did. We could have just scratched our arm in the middle of the night and ended up the next morning with a bruise. So all of that, cracking, bruising, skin tears are very common as we age. Wrinkles and fine lines, I don't know about you all, but I don't have any of those, right? I think we can all say we have wrinkles and fine lines. I have a bad habit of raising my eyebrows, so I have those forehead lines. Age spots and scaly patches. Age spots really don't have as much to do with age as it does with history of sun exposure. So those brown, scaly little lesions, some of them are flat and not scaly. That usually comes from a history of sun exposure. And I grew up here in the South, and most people, no matter where you grew up, you had some exposure to the sun. Higher risk of skin cancer as we get older. And I always tell residents that it's not the sun exposure that you recently received. It's the sun exposure that you received when you were younger, before we knew better. So before the age of 18, those sunburns that we experienced are what increase our risk of developing skin cancer later in life. So our aging skin heals more slowly. You all may notice that if you get a cut, a scratch, or you have a little biopsy performed, that it does take longer to heal than it used to 20, 30 years ago. So taking care of your skin is very important. The sun affects our aging skin. So the UV rays definitely accelerate the breakdown of our collagen and elastin. So if you can give your children, your grandchildren, great-grandchildren any advice, it would be wear your sunscreen, wear a hat, stay out of the sun. I used to take pride in my tan. I used to have, darkly complected skin when I would get outdoors, and I've had people tell me they remember the days of mixing baby oil and iodine. Yes. And so we would all, show off our tans. But now, there's not a lot that I'm showing off because I don't see the light of day very much. So the UV rays do accelerate that collagen loss. People usually ask about the difference between UVA and UVB rays, but both of them contribute to the sunspots, the wrinkles, the skin cancer. So when you choose a sunscreen, you want to get one that says it's a broad spectrum. It's going to protect against UVA and UVB rays. And this is where we were talking a moment ago about lifetime sun exposure plays a role in our health. And so again, it's not just what you've received over the past 5, 10, 15, 20 years. It's usually what has occurred throughout your lifetime. Damage from that sun shows up years later, but it's never too late to protect against further problems, further skin cancers. There are many medications that can make our skin more sensitive. Usually when you have that medication from the pharmacy, on the side of the bottle there will be a sticker that says avoid sun exposure, limit sun exposure, may increase the risk of sunburns. Common antibiotics are sulfa, if you have ever taken sulfa, if you've ever taken doxycycline, and both of those are things that we use in the clinic frequently. Those can increase the risk of sunburns. Water pills, those diuretic fluid pills, those often also carry the risk of burns and increased risk of rashes. Heart and blood pressure medications, I don't know about you all, but most people I see in the clinic have high blood pressure or some type of condition where they may be on a heart, even protective medication. So a lot of those medications can also contribute to sunburns and sun damage. So if you have sun sensitivity, let's review your medications. And then, of course, if you're on one of those medications, you want to take extra precaution and use sunscreen, wear long-sleeve clothing, wear a broad-brimmed hat, and seek shade when you're going to be outdoors for long periods of time. I think that is a duplicate there. Recognizing skin cancer. Who is familiar with the ABCDEs of recognizing skin cancer? Yeah, not as many hands. This is something that has been around for a long time. So we all have moles. Moles, the fancy name is a nevus, but we all have moles on our skin. And what we want to look for when we're looking for melanoma, which is the most dangerous type of skin cancer. I always say melanoma is the one that can spread other places. That's the one you do not want. If you have to have any, you would want a basal cell or a squamous cell. They're more tissue destructive. They grow down and out. Melanoma grows down, out, and gets into the bloodstream and the lymphatic system and can move to other organs in the body. So when we're looking or talking about screening for melanoma, you want to always take a look at your body as much as you can, or have a friend or a spouse take a look at your back, or have a provider or dermatologist look. But you're looking for any moles that are asymmetrical. So I always say if you can take a circle and put around it and it looks fairly normal, then we're not as concerned. But if one side of the circle is nice and smooth, but then the other side is really jagged, is scalloped, and it looks asymmetrical, that's concerning. It does not mean it is a melanoma, it just raises our concern. We're also looking for border irregularity. Back to the asymmetry, I'll also say cut it in half. If you were to cut that mole in half, is the right side going to look like the left side? And if it does not, then you have to pay careful attention to those lesions. Border irregularity, again, not every jagged-edged or scalloped-edged lesion is dangerous, but you do want to watch those lesions a little bit more carefully. Color variation, you would like to see a uniform color throughout the mole or the lesion, and if you have an area that's darker, maybe an area that's pink, or if there's a halo around it, then that is more concerning and should be monitored closely. And then the diameter, larger than a pencil eraser. Most pencil erasers, or the end of a pen, are about 5 millimeters. And so if it's larger than that, you should be watching that lesion carefully. A lot of dermatologists now will take photographs of the lesions that they're monitoring. So they'll take a picture, they'll label it in the chart, the location, which side it was on, whether it was right arm, right leg, left leg, front of the leg, back of the leg, and that way they can sort of keep up with where it is. They often will also use a map of the body. If you ever look, they have a little map of a person standing there like this. And then the back of it will be like this. And so they'll draw little circles as they are noting different lesions that they're keeping a watch on. And then the E, when I was in school, we didn't have E. We had A, B, C, and D. And over time, they have added the letter E to this because a lesion should not be changing. Once we develop our moles in lifetime, they should not be changing in color, size, shape, or irregularity. And if they begin evolving and changing over time, then that's more concerning as well. So being seen by a primary who can look at it and determine if you need to be seen by dermatology, or being seen by dermatology once a year is always wise. Ask for help. So what I mentioned a little while ago, it's hard to see everywhere. I can't see my back. I can hold a mirror up, but unless I've got binoculars and holding a mirror, I'm not really going to be able to inspect my own back. So ask a trusted friend, family member, caregiver, or one of your providers to take a look at anything that you aren't sure about. I have a lot of people come in and they say, I feel something up here. What is this? Because it's in an area. The top of the head gets a lot of sun exposure, and things get crusty, and things grow, and things bleed. And so anything that develops that you're not sure about, be sure to have someone take a peek at it. So this is just expanding on the A, B, C, D, E of checking for melanomas. They mention here using a full-length mirror, a hand mirror and good lighting, sit in a chair if it's needed for balance. I like to add here, look for anything that is new. Something that's new and is developing is more concerning, and something that's changing. Sores that won't heal, so something that's persistent and not going away despite you keeping it covered, despite you treating it with antibiotic ointment, and areas that are red, scaly, or bleeding. Any of those things could represent a basal cell, a squamous cell, or potentially a melanoma. The one scary thing I haven't mentioned is that melanoma can be amelanotic, which is it has no pigment. So typically we think of melanoma as being those black moles that are really dark, and those, of course, are dangerous. What I think are just as dangerous are the ones that we can't see. And that is what happened to a friend of mine. And she unfortunately passed away last year in her 40s of metastatic melanoma. And they never identified the original site. So she probably had an amelanotic lesion that no one could see, and it spread to other areas of her body. So that is possible. And with those situations, unfortunately, there's not a lot that can be done. And her diagnosis came when they found it in other organs, which is unfortunate. Step-by-step skin care or skin checks. If you've ever been to a dermatologist, I'm not sure which is worse, going to a dermatologist or going to the gynecologist, and you women will know what I'm talking about. I think I have less clothing on during dermatology than I do with my female checkups, because my dermatologist will make you take off your watch. She looks under your watch. She looks under bracelets. She is looking behind earrings. She does not want you to have makeup on when you come in for your skin exam. Moving necklaces, looking in between fingers and toes and underneath, and you are doing acrobats in the room because you're standing up and you're turning around, and then you're lying on the table, and then you're rolling over on the table, and she's separating and looking at everything. So dermatologists are very thorough, or should be, I should say. I've had a few of you tell me that your dermatologist has not been very thorough, but that is what I am accustomed to when I go to see the dermatologist. She's looking behind ears, she's looking through my hair, separating my hair. I mean, you come out, you're glad you didn't have makeup on, and probably glad you didn't have your hair solidly fixed, because you're quite a mess when you leave. That is what a dermatology check should look like if you're going in for that. Finding the right sunscreen. So I mentioned earlier, broad spectrum should be on the label. That means that it's going to protect against UVA and UVB rays. UVB are what tend to cause the sunburn, which leads to skin cancer. UVA tends to cause the wrinkles and aging, and most of us don't want any of those things. So broad spectrum, full protection sunscreen is recommended. And if you weren't here when I mentioned it, I will have some 1-ounce samples of, I think it's Banana Boat sunscreen, but they did not arrive earlier this week as they were supposed to. They were delayed, and they'll be here today. So tomorrow I will have them in the clinic if you want to come by for a sample. I always recommend an SPF of 30 or higher. Anything lower than that, you're not getting that much benefit. My chapstick, for example, my Blistex medicated chapstick, it only has an SPF of 15. That's not great. It's better than nothing, but I do reapply it frequently throughout the day. But if I'm at the beach, I usually go with a broader, higher SPF sunscreen. So I usually go with like a 50 or a 70. 30 is what I recommend starting with. 30 blocks about 97% of the UVB rays, and you get even more benefit from the higher SPFs. Let's see here. So water resistance matters if you're going to be at the beach, if you're going to be at the pool. So if you're outdoors and are going to be sweating, doing yard work, gardening, hiking, walking, anything like that, you are going to lose moisture out of your body, and that is going to make your sunscreen need to be reapplied more frequently. So reapplying sunscreen every 2 hours when you're outside is recommended. And don't forget, if you're taking a handkerchief and wiping your brow, wiping your forehead, taking a beach towel, wiping water from under your eyes or rubbing your eyes, that you're going to need to reapply the sunscreen more frequently in those areas. My family always forgets this, and every year at the beach, someone gets a sunburn. And it's usually because they went and rubbed something off of their face and forgot to reapply. So make sure you're reapplying after water exposure or if you've been rubbing your face. Some people have sensitive skin and need different formulations that are free of certain products. Some people have had allergy testing, and they know the items that should not be in their moisturizers, their face products. You can always look for sensitive skin or fragrance-free sunscreens. Zinc oxide, who remembers zinc oxide? It's like, looks like shoe polish. Looks like streaks of shoe polish on your face. Zinc oxide or titanium dioxide are the gentlest forms of mineral sunscreen. These protect right after applying, so there's no need to wait before you get wet, no need to wait before you jump in the pool. But definitely these are more gentle sunscreens that can help with delicate skin. Choosing one that's easy to apply. I tell people, I don't care if you use the rub-in or you use the aerosol. A lot of earth-conscious people will say, oh, don't use that spray sunscreen. Don't use the aerosol kind. And I can understand where they're coming from. And at the same time, if you've got a small child at the pool, you're just lucky if you can just get them covered in something before they're ready to jump into the pool. So I always say use what you need to use in order to wear it. If you have the time to rub your entire body, face, neck, back, arms, legs, with a liquid sunscreen that comes in a tube or a bottle, go for it. But if aerosol is what makes it easier and makes you more compliant with wearing sunscreen, then go with the aerosol. Lotions and sticks are often easier for the face, I think. Sticks are good for noses, ears, and around the eyes. And I guess the reason I like the aerosol at times is especially I don't trust my husband on my back. So when I need sunscreen on my back, I don't want to have a burnt area. So if I just have him go left to right with aerosol, I'm more likely to get good coverage than if I have him rub it. I always end up with a burnt spot. Check your expiration dates on your sunscreens. Things do expire. And just like medications, it doesn't mean that you can't use it, but if it has expired, it's going to be less effective. And if you carry sunscreen in a beach bag and it's been in that beach bag for 3 or 4 years, and every time you go to the pool or every time you go to the beach, it's getting exposed to the heat and the sunlight, then it's going to make it less effective. So think about every summer updating your bottles and buying fresh sunscreen so you've got the strong protection. I don't know about you guys, but a shot glass size amount of sunscreen to cover your whole body, maybe. That seems like a small amount. I think of a shot glass. I'm not a bartender. What is it, 2 ounces? 3? 2? Okay. Yeah, so 2 ounces, that's, I think that's a small amount to cover your whole body. And maybe I'm just super conscious and use probably double the amount that I really need, thinking I'm getting extra protection. But when I'm doing my face, my ears, I get inside of my ears, behind my ears, the tops of my ears. One area you don't want to forget is your hairline, or for some gentlemen, is just your scalp in general. I'm fair-skinned, light-eyed. light-colored hair, and one thing that usually gets burnt with me in the summertime if we're outdoors is my scalp, and I tend to forget about that. So always, that's where aerosolized sunscreen is really helpful. You can just spray a streak across your part line, take your fingers, rub it in a little bit, and then you're covered. Also, the crown of your scalp, think about that area too, because it easily parts and then the sun hits it. So be sure to use enough sunscreen to cover. Don't forget the tops of your feet. This is my father-in-law. Every year he forgets to spray or add sunscreen to the tops of his feet. He gets burnt on day one and then can't go outdoors the rest of the week. I think it's a gimmick. I think he does it intentionally so he doesn't have to go out on the beach, because we tell him every year, don't forget to spray the tops of your feet. The backs of the hands, under your watches, under straps, I think about. So women for bathing suits, make sure you move that strap out of the way, get underneath that strap, and then put that strap back in place. Because our straps do wiggle and move when we're at the beach or at the pool. So do the tops of our swim trunks, and you don't want to have an area that gets exposed that did not get sunscreen applied. So again, reapply every 2 hours, even more if you're sweating or swimming. Clothing. I mean, a lot of manufacturers now are designing and selling clothing that is SPF. It has SPF protection in it. We know sunglasses are important for protecting the eyes. We know hats are important for protecting our ears and our neck. But if you're going to be outdoors, a long sleeve shirt, some of them button down. Some of them are, I don't know what you call them. I'm going to call them a fisherman's shirt, but they have vents in them, and that's really nice because if you're outdoors, you can get a breeze through some of those items of clothing. The time that you don't really want to be out are going to be those main hours between 10 and 4. I used to always think of 10 to 2, but honestly, you know, in the summertime, it doesn't get dark until 8:30 at night, so we're thinking about those strong sun rays are still active even late in the afternoon around 4 o'clock. Using umbrellas and tents, protective barriers are always smart. And if you are even driving, sitting near a window, going for a short walk or a ride, always throw on your hat, have your sunglasses, have water with you, apply your sunscreen before you go outdoors. All of that is very important. I have some extra sunspots on the right side of my face. So my dermatologist said, have you been a passenger princess your whole life? And I'm like, no, I'm the mom who's still driving, you know, kids around. So usually most adults who drive, their left side of their face is the side that gets more sun exposure. The left arm, the left hand, because we're holding the steering wheel or our arm is near the window. And then passengers typically get it more on the right side of their face and their right arm. I would like to think I was a passenger princess, but I'm not. Keeping your skin hydrated is very important. Many of you have seen me check for skin turgor in the clinic. I'm going to have to set my microphone down to show you because I have to do it. Well, maybe I can do it like this. Checking for dehydration and skin turgor means taking your hand flat, pulling up the skin on the back of the hand and watching to see how quickly it bounces back. If it bounces back quickly, then you've got some good collagen, you've got some good moisture in your skin. If it stays up like a tent and it goes down very slowly, and within 5 seconds it's still kind of sticking up, that means you need to drink some water. We won't take a poll here and find out whose skin turgor is poor, but usually in the morning our skin turgor is not as good. So that's also why in the clinic, when you're coming in for blood work, we recommend that you drink plenty of water before you come in. And it's not just the morning of, but it's even the day before. If you're going to have lab work done, Martha's over here drinking. I looked over and she's sipping. She's taking my advice. But for blood work, you even want to hydrate and get hydrated the day before your blood work. That's what's going to plump up your blood vessels for easier access. Keeping your skin hydrated means not only drinking water, but using moisturizers. They now are saying the moisturizers with ceramides and hyaluronic acid will help add moisture and protect our skin. So that's what you want to look for when you're shopping for your skin products. You want to sip water throughout the day, not just with meals. I know this is hard. I find that during the day I'm talking and I'm working and I'm meeting with patients, and I'm usually not sitting in the room with a water bottle. But I've been in the room with many of you, and I've had to step out to get a drink of water because my throat gets dry or I get a tickle. So sipping throughout the day is very important, not just drinking with breakfast, lunch, and dinner. That's going to keep you hydrated as you continuously give your body fluid. A situation that I'm going to throw in here, we're not talking about gastric health, but anyone who has been sick and has had diarrhea or vomiting, you've lost a lot of fluid out of your body, and you need to sip and restore your fluid slowly. When you've been sick, you shouldn't go and grab an 8-ounce bottle of water and chug it. You should be taking one sip every 5 to 15 minutes to make sure you can keep it down and tolerate it. So that's not skin related, but the idea of rehydrating is usually a slow process. So think about small amounts more frequently. Keeping a water bottle nearby or carrying one with you is very important. My mouth is getting dry now. I have my water bottle here on the stage. But keeping it with you, you're more likely to drink if it's in your hand, if it's in sight, if it's near your chair or your television or your computer. Eating water-rich foods. Who's glad that the bistro has watermelon back on the bar? Yeah, it gets gone quickly, doesn't it? So watermelon is mostly water, so eating foods that are high in water. Cucumbers are also high in water content, so eating cucumbers. If you're not a fan of water, some people don't like it because there's no flavor. Well, without adding any sugar content to your water, you can add cucumbers to your water, and I think it gives you a very nice, crisp, fresh taste. And just like our dining department has done today, I'm not sure what else is in there, but there's oranges in our water today. So you can always add fruit to your water as well. Vitamin D, it's made from sunlight, but what did I just tell you guys to put on when you go outside? I told you to block the sunlight. I told you to wear sunscreen. So the majority of Americans are now vitamin D deficient. One, because we either don't get outdoors and get enough exposure, or we are wearing sunscreen when we are outdoors, or we're wearing hats and protective clothing. So a vitamin D level is something that is often checked by primary care providers now to check for vitamin D deficiency. If your level is normal, no need to take extra vitamin D. But if you have a low vitamin D level, then you will get benefit from taking a supplement. So 10 minutes of sunshine every day can help, and that could be 5 minutes in the morning without sunscreen, meaning go for a walk, go for one little loop around the pond, come back. That without sunscreen might be enough to help boost your vitamin D level, but if you're going to be out more than 5 minutes, you should have sunscreen on. And then maybe a 5-minute walk later in the day. Drinking milk that's been fortified with vitamin D, or breakfast cereals that have been fortified. Yogurt and other dairy products often have high amounts of vitamin D in them. That can help your vitamin D level, and that can also help create healthy cells in your skin. Fish naturally contains vitamin D, so things like salmon, cod, and tuna. And then again, like I said, you can take supplements if needed. Sometimes we do all of these things. We eat salmon, we get sunshine, we drink milk, and people are still surprised when they come in and they say, wow, I'm surprised my vitamin D level's low because I already do all of these things. And that's just an example of how we often need supplements in our life. Vitamin C is found in the inner and outer layers of our skin, and it's a cancer-fighting antioxidant. Most people think of only taking vitamin C when they're sick or ill, coming down with a cold or a sniffle, and certainly you can do that, but vitamin C helps aid in collagen production. So often you'll see the face creams and lotions have vitamin C added to them. Vitamin C deficiency is very rare. What was it, scurvy? Who sees scurvy anymore? We don't typically see that due to the prevalence of the citrus fruits that we have available to eat. But things that are high in vitamin D are citrus fruits and broccoli. I'll take citrus. I don't know about you. 1,000 milligrams of vitamin C is typically the recommended amount. Most of us get that in our diet, but if your diet is not optimal, then that's where supplements usually come into play. Vitamin E is also important for the skin, as well as vitamin K. Vitamin E is also an antioxidant, so it helps to protect and fight against cancer. It also helps treat inflammation. So some dermatologists, if they have a person with a rash or if they have a particular skin lesion that's not healing, they'll have you purchase vitamin E, take a pin and poke a hole in it, squirt out that little soft gel cap of vitamin E, and then rub it onto the skin. So, but most of our skin products also have vitamin E already contained in it. Eating nuts and seeds, almonds, hazelnuts, sunflower seeds are high in vitamin E, so that can be helpful. Vitamin K is essential for blood clotting. It also helps heal wounds and bruises in areas after surgery. The problem with vitamin K and the problem with green leafy vegetables like kale, spinach, lettuce, cabbage are people who are on a particular blood thinner called warfarin or Coumadin. If you have a friend who's on that or you're on that, you know that you're encouraged not to eat those things because while you're taking the blood thinner to thin your blood, you're eating things that are high in vitamin K, which thickens your blood. And so it's counterproductive for someone on warfarin to eat too much vitamin K. In fact, if your warfarin level is, your blood is too thin, the treatment is vitamin K. They give you vitamin K to reverse it. So keeping your skin healthy, sunscreen, shade, protective clothing. Don't smoke. We didn't talk about that, but smoking increases the loss of collagen. And be gentle on your skin as much as you can. We're all going to end up with senile purpura, even if we're not senile, right? But it can happen. Just you have to be gentle. Eat healthy, eat a vitamin-rich diet, try to manage your stress, and hopefully your skin will stay healthy. So there's a little quiz here at the end. We can do this together. You don't need sunscreen on cloudy days. Who thinks that's true or a myth? False, yeah. Yeah, you do need sunscreen on cloudy days. In fact, it's the cloudy days where you'll get more sun damage. A cloudy day at the beach can be treacherous for your skin, and you won't realize it till you go inside and take a good hot shower to get that sunscreen off, and then you'll really regret it. You can get sunburn through windows. True or false? True. Wearing a hat completely protects you from the sun. False, that's right. So even a broad-brimmed hat can be protective, but you still need your sunscreen on underneath it. Sunscreen only needs to be applied once a day, true or false? False. And then the sun's rays are strongest between 10 and 4. True, that's right. And then that's the end. So what do you guys think? Any questions for me about sun damage, skin cancers, dermatology visits, sunscreen, lotions? Yes.
I don't go to the beach and I don't lay out in the sun.
Right.
Do I need to put it on daily?
It depends on what your goal is. So the question was, I don't go to the beach and I don't lie out in the sun. Do I need to put sunscreen on daily? I would say, first question would be, how much time are you outdoors or in the car? And if you're going to be outdoors or in the car for 15 to 30 minutes, then yes, you likely should wear sunscreen. Only on the sun-exposed parts of the body. Most of us are worried mostly about wrinkles, our aging skin, the things that people can see. So it's usually face, neck, hands, and arms. Those are usually the areas that if you want to wear a daily sunscreen, I would recommend those areas. I'm not consistent with it. It's in my moisturizer. I do put it on every morning, but I'm not reapplying it. But I'm also down here in the basement and don't have a window and usually leave close to dark at night. So for me, I'm not reapplying my daily sunscreen. So you just have to decide how much you're going to be out and then what your goal is. If your goal is to kind of minimize wrinkles and aging, then sure, every day you should put on a sunscreen. That is the loaded question. So last year, I don't know if you all remember, but Steve Yulin was here during our talk, and Dr. Yulin hired me for my very first job as a PA 26 years ago, and I gave him the microphone on that question. There are mixed studies, and none of them are great studies. Collagen powder can be purchased. A lot of you may be familiar with that. There are collagen powders that they sell just like they sell protein powder, and you can put a scoop in your coffee, you can put a scoop in your beverage throughout the day, and it does increase the collagen that goes into your gut. Now, then the whole process is anything that we take by mouth that ends up in our gut has to be absorbed into our bloodstream, and then it has to be absorbed out into our skin. So there's no great way to get collagen. Through the digestive system, it's going to take the absorption process, and then the question is, how much are you really getting? And I don't think that anyone can really answer that question accurately. And then we know anything that's applied to the skin has to be absorbed. And so depending on how much collagen your skin products have, we know that you have to penetrate layers of skin in order to be absorbed where it needs to be. So that is a great question, Kathy, and if I ever get the answer, I might be a rich lady. Is it a reason not to take collagen? No. If you want to take it, if you can afford it, it can be costly. Or if you yourself feel like you have had health benefits from it and you say, oh, definitely, with me taking this collagen, my skin looks so much better, I have less wrinkles, I have thicker skin, firmer skin, by all means, do it. If you're not taking collagen, I wouldn't rush out and go buy any. So, yes? Yes. Yeah, so the question was regular clothing that's not a special material that's marketed for sun protection. How good are we doing? Well, it sure beats exposing the bare skin, so it's better than nothing. I think it comes down to timing. How long are you going to be out? How long are you going to be in full sun? Covering up on the beach with a beach towel over your legs and feet, that's going to be better than exposing your bare skin. So if you're just going to be out, playing bocce ball or cornhole, and you're only going to be out for just a short time, I think your regular clothing is appropriate. Now, if you're going to be out prolonged, you'll want to have sunscreen on and clothing and a hat and sunglasses. So I think the duration of time that you're out depends on how much protection you should have. Any other questions? No, everyone's quiet this morning. Okay. Well, come by and see us tomorrow in the clinic, and I'll have some lotion and sunscreen samples. And don't forget to grab some goodies on your way out that the dining department provided us with. And I will see you guys next month.